Welcome back to the Grow Your Nutrition Business podcast, powered by Healthy Subs Nutrition Mentoring. At HSN, we believe something as fundamental as nutrition shouldn't be complicated, which is why we focus on a simple, habit-based approach when working with clients. We know that helping them become the best and healthiest versions of themselves isn't just about coming to the gym a few hours a week or telling them what to eat. We have to focus on a holistic approach, addressing nutrition, stress management, mindset, sleep, support system, lifestyle, and of course, exercise. My name is Nicole Aucoin. I'm one of the dietitians here at Healthy Subs Nutrition and the founder of Healthy Subs Nutrition, home of CrossFit HSN and HSN Mentoring. In this podcast, we are going to teach you how to take one step at a time to build a successful nutrition coaching program. Today's topic is probably something that I am most passionate about. It's because I have personal experience being on the other side. We're talking about healthcare partnerships. And I want to start off by talking about how Healthy Steps Nutrition started. So our HQ location is down in South Florida. I went to school at University of Florida, go Gators. And after college, after grad school, I actually worked at a pediatric office and realized that I needed to get a full-time job. I needed to have a little bit more revenue than doing some contract work at the pediatric office and working at a restaurant. So I got a job as a dietitian in the hospital down in South Florida in Boca. And this was my first job in a hospital. I knew I didn't want to do clinical forever, but that's the easiest way to get a full-time position as a dietitian. And that's kind of what they say, like that's the standard route of what you're supposed to do when you become a dietitian, at least when I went to school. So get a job as a hospital dietitian. And I was the only dietitian for this hospital. So there was an ICU, a cardiac floor, a regular floor, a pediatric floor, a pediatric ICU. I mean, I got so much experience at this hospital. It was awesome. But it also made me realize that most people coming into the hospital had no support to help them create the lifestyle changes and the lifestyle interventions that they really needed to not come back to the hospital. The hospital was a revolving door. People came in, they got medications, they left for a little bit, and then they would come back in. We had frequent flyers at this hospital. And when you look at chronic disease, 9 out of the 10 leading causes of death in the United States are caused or worsened by elevated blood sugar. Most of the situations that I dealt with in the hospital, the people had diabetes. So they had some type of issue where they weren't able to manage their blood sugar, which caused kidney issues and infections and all these other complications that happened. And I will tell you the most frustrating part of me working at the hospital was around diabetes management. People were allowed to have 60 grams of carbs for a meal, and it could be whatever they wanted. They could have 4 juices if they wanted their carbs to be that. And we know that different types of carbs will integrate into your body and your body responds to them differently. And it will spike your blood sugar up real fast, or it could be a slow, incline, which if your blood sugar goes up real fast, then it's going to come down real fast. But people with diabetes, especially people that are in insulin dependent diabetes, now we're having to give their body massive doses of insulin so that their blood sugar crashes back down, and it's this vicious cycle. They don't feel well. But I had to follow certain rules at the hospital. I had to tell people, here's how to manage your blood sugar. Here's what you can have in the hospital. And they could, again, eat anything that was under 60 grams of carbs. It was crazy. We had to give people that didn't eat 50% of their food a sugar-filled supplement if they weren't having diabetes, and then one that was made for diabetics that was just a bunch of junk in it if they didn't eat 50% of their food. Now, if I was in the hospital, I wouldn't eat 50% of my food because it's not that great. I'm getting a little bit distracted here, but moral of the story, I hope you guys are getting the point that the hospital system where most people end up when they don't take control of their health is broken. And when we take it a step back with primary care doctors, your general physician, the average doctor's office has 1,000 patients, 1,000, up to 2,400 patients that they're seeing annually. The average doctor spends about 17 to 24 minutes with one patient. Now, I can tell you that I spent, maybe at most 30 minutes with a patient, but I would see 30 people a day. And I wasn't working longer than 8 hours at the hospital every single day. So it was a lot less between all of the paperwork that we had to do before and after meeting a patient and charting and stuff. So, and the same thing goes with doctor's offices. They're not spending enough time to address lifestyle interventions, and there's no accountability. So, what I did at the hospital is if someone had issues that they needed nutrition management for, we would print out a sheet and we would hand it to them. Now, in that setting, they're more worried about what the doctors are saying, what the nurses are saying, and what medications they're on, and the chronic issue, the acute issue that's happening while they're in the hospital. They're not paying attention to us. Like, they don't care about that. In the doctor's office, they might care a little bit more, but there's not enough time to provide accountability and support. It's just not there. People are talking about their medications. Maybe they're saying, "Oh, your blood levels are good," but they're probably not even saying that. I mean, you go to the doctor, they give you an order for blood work, and then you get the blood work and you get a call that says it's good or it's not, and here's a medication to deal with it. When in reality, if we addressed it with nutrition, sleep, mindset, and daily movement, we could probably mitigate a lot of the issues that are happening without all of the medications. So hopefully you get the point now. There's a lot of issues with the traditional system. The healthcare system is broken. It's not healthcare, it's sick care. And I truly believe that health starts inside of our gyms. So why am I saying all of those stories? I can say from personal experience, and I've worked with multiple doctors. Now, even when I worked at the hospital, there was a pediatric physician who worked in a pediatric GI that I got to spend a lot of time with him, Dr. Hernandez in Boca Raton, and he realized like, hey, Nicole, I've got a lot of patients coming in my office. I don't have time to address the issues that are going on. Many of them have fatty livers, which directly comes from excess consumption of processed carbohydrates and lack of activity. And parents just don't know what they need to feed their kids, or they don't want to fight them and they just give them whatever they want. So the doctor was like, Nicole, can you come into my office and start seeing these patients? So they would come in, I would see them monthly, and I basically worked inside of his office, inside of the pediatric office. That was the first partnership that we created with a pediatrician. It was back in 2012, 2013. It was early on in the career. I honestly was just starting Healthy Steps Nutrition, and that's where I got a lot of the clients that I saw. And they saw good results. And then when we opened the gym, we started combining nutrition and fitness with these kids, and they saw really amazing results. We were able to reverse the fatty liver that they had because of the lifestyle interventions. They didn't need to go on medications. We changed it through diet and exercise. And it wasn't just the kids, it was the family. So it was a full package deal. It was amazing. But we took that model and started partnering with other doctors, other physicians, adult physicians that all had the same issue. They knew that they weren't able to provide their clients the support that they needed to promote lifestyle changes, and it just wasn't set up in the system. They're not able to bill insurance for the same rates that they could for the medical stuff that they were doing. So they partnered with us and we worked together with those clients, and it worked, still does work really, really well. So this is something that we've been doing for a while. And about 7 months ago, I started talking about it with gyms in HSN. I'm like, you guys need to start doing this. You guys need to start connecting with doctors and understanding the way the system works. Because the truth is, if you're a gym owner or a nutrition coach, the likelihood of you actually being involved in the system of chronic disease and dealing with all of this stuff, maybe you have a relative, a parent that has to deal with it, but the likelihood of you really knowing and understanding the inner workings of this isn't really that likely, because a lot of us are super healthy. So luckily we don't have to deal with this. But I tried to explain like, hey, this is the way the system works. And it's not just here, like it's everywhere. This is the way the system works. So how can you set up partnerships with healthcare professionals so that you can have a consistent relationship where you're helping the patients with the lifestyle intervention piece that's not able to be provided in the doctor's office? So, how do you do it? I want to talk about how to do it in this episode. There's been more traction and more talk about this. Morning Chalk Up wrote up an article. I'll link it in the show notes where they interviewed myself and Athena Perez. She actually partnered with a bariatric facility, which I think is really cool. I definitely want to do that here locally as well. So let's talk about what are we doing? How do you do it? So the first thing I would recommend that you do is you need a professional nutrition coaching program. If you're going to partner with a doctor, you need a program that delivers results, that you're providing a consistent experience with, that if someone's referring, if you refer one of your members somewhere, you want to feel confident they're going to get taken care of and it's going to be an awesome service. Now, you need to be able to provide that same level of experience when you partner with a doctor's office or a physician. So, what do we need to do? We need to make sure that we have the systems in place. And then we want to look for people inside of our network who are already in the healthcare system. Do you have any office managers, doctors, nurses who work in the private sector in a private practice that are in your ecosystem? Any members that are doctors, office managers, nurses, those are the people that you want to talk to. I would encourage them to sign up with your nutrition coaching program, let them experience it, and then say, hey, we would love the opportunity to work alongside you to be able to support your clients with lifestyle interventions. If when you become a doctor, when you become a nurse, like your goal isn't just to push medication down people's throats, but that's their line of defense because that's the only support that they can actually do and achieve results. They don't have the system set up to provide support and accountability. And doctors don't go through a ton of nutrition education. Like they may have one nutrition course and that's it. So what can you do? You want to talk to the people in your ecosystem. If you already have systems in place and you already have a professional nutrition coaching program, you already have success stories, I would say, hey, I'd love to have a conversation with you. You know that we've been offering nutrition here for a while and we have seen some really good results. Our clients are doing this and that. And we'd love to be able to support people outside of our gym. We'd love to work alongside you and be able to provide that lifestyle intervention piece for your patients. Could we set up a meeting? If it's a nurse, do you think you could introduce me to the office manager, the doctor, so that we can have a conversation? It all starts with a conversation. They're either going to say yes or they're going to say no. And you should not feel scared to hear a no. If they say no, okay, great. There's a million doctors around. Like there's so many doctors around. You could go to the next person. Make a list after this podcast episode of all the medical professionals you know in your local area and start having conversations with them. Now, let's say you've got a doctor's office and they're like, yep, we would love to start working alongside you. Now, I have done this well on accident before, and I've done this not well and made some mistakes. Now, if a doctor is coming in to see a patient, and let's say they're the ones that are like, hey, I want your nutrition program in. You guys are amazing. Yes, I want you guys to support my clients. Okay, or my patients. Awesome. If they're the only ones that know about your service and can talk about your service and recommend your service, and they're only spending a couple minutes with the patient, and no one else in the office knows about your service and can guide people to take the next step, the likelihood of someone taking the next step is not as likely. You need to make sure that everyone in the staff knows about your service. What do you do? How do you help people? How do you solve problems? How does it work? And what is the next step to take? Now, we've created prescription pads that literally have a QR code for our discovery call for people to book a discovery call. I don't have them come in for a free intro if they're just looking for nutrition. Now, the truth is, when you are doing healthcare partnerships, what we found is we're attracting people beyond the normal radius of people we're recruiting for the gym. You know, our normal membership, they're within a few miles of our gym. When we have doctor partnerships, these people are coming from like a city, two cities over. And the reality is they're not starting with fitness. They're starting with nutrition. And then we might get them for personal training, or we might get them to join classes later on. But in reality, we're starting them, most of them, with nutrition. Do you have a nutrition only service that you offer? Do you have a package? If someone were to ask you, what does your nutrition coaching program look like? How does someone get started? What are the benefits? Can you tell them? These are all things that you need in place to be able to deliver a professional nutrition coaching program and partner with healthcare professionals. But this is such an amazing opportunity. People that are going to these doctor's offices need help with lifestyle interventions. Now, there are some legalities. If someone has a chronic disease that requires medical nutrition therapy, you need a dietitian. So if you end up creating a lot of these partnerships, it would make sense to bring on a dietitian on staff so that they can support the complicated cases and your nutrition coaches can handle everyone else. This is a really great opportunity. Another really cool opportunity is there's a lot of different concierge nurse practitioners and different types of facilities that are opening up that are cash pay. They're not going through the traditional system. So we actually are setting up something right now at our HQ location that's not only going to be used for our HQ location, but it's also going to be for any gym in Florida that wants to partner with this company. But basically, it's a nurse practitioner. Her husband's an ER doctor. She's worked as a nurse in the ER for a really long time. She's actually the one that introduced me to CrossFit. I'm so excited to be able to work alongside her. But she's going to work with us where we can work together, get blood work. She can prescribe some medications if needed, but be able to provide the medical side. And then our team is providing the lifestyle intervention side. Now, you can, at your facility, do the same thing. Partner with someone who has that type of facility. There's so much information out there. Ozempic is such a popular topic. I get questions about this all the time. What about these GLP-1 medications or hormones? What's your thoughts on them? And I've done a lot of research on this. And the truth is, when you look at, here's the way I describe it. If we have a roof leak and I just put a tarp over the roof leak, if I just put a tarp over the roof leak and I don't actually fix the roof leak, what happens to all the damage that's happened from the water coming in? Am I going to have water floor damage from the water? Am I going to have mold that starts appearing? What other kind of complications am I going to have because of the roof leak? What happens when another storm comes, and in Florida, we have a lot of hurricanes. What if a hurricane comes and blows the tarp away? That's kind of how I feel about Ozempic. You're masking, you're putting a Band-Aid, a tarp over a fundamental problem that really we need to address the root factors. What's caused someone to have some issues that they require that medication? Are they over consuming processed carbohydrates? Are they not sleeping enough? Are we not exercising? Do we have chronically high cortisol levels? Are our hormones messed up? What's going on under the roof, under the tarp that are causing all of the issues? A weight issue isn't someone not getting overweight overnight. No, there's a lot of things, there's a lot of habits, there's a lot of lifestyle that's happening that's causing someone, and that's just a symptom. We need to get to the root cause. So, can you partner with some of these doctors that are prescribing some medications? Do I agree with them? No, but I think there is some research depending on the dosage. We have a couple clients that there's a local doctor here that's prescribing tiny doses, like 0.25 to 1 to a half a unit of Ozempic instead of the 0.5 to 2 units, which is the normal, which is causing all of the complications. And we're able to work alongside them to provide the nutrition interventions. The healthcare system is broken. I believe that health starts inside of our gym. And when we can partner and work alongside healthcare professionals, we're able to significantly amplify our impact. I think we're all dedicating our lives to help people get healthy. And if there's a route that we can expose more people to how to cut through the noise and create simple lifestyle changes, why wouldn't we do that? So if a doctor says, yes, come into our facility, your first step is to train the staff. Your second step is to make it so easy for someone when they say, hey, you need to call Healthy Steps Nutrition, that you have something available for them to take that next step. Is it the person that's at the front desk that's checking them out goes ahead and books a discovery call for them? Is it the prescription pad that has the QR code for them to book a discovery call so they can get in your funnel? Maybe it's a downloadable guide. Hey, here is a beginner's guide to meal prep. fun fact, when you look at all of the Nutrition Made Simple podcast episodes, that's the podcast that we release like to the world with nutrition tips. All of the top episodes are related to meal prepping. It's a popular topic. People want to learn how to meal prep. So could you have a downloadable guide with a couple easy recipes and then have videos of you, the nutrition coach, the owner, so that people can start getting to know you? When people feel like they know you, they're more likely and trust you, they're more likely to do business with you. So if you create some automations where they're getting to know you, you're providing these simple tips and they're starting to do them, they're going to gain confidence that you can help them more. So when you're thinking about doing these healthcare partnerships, first start with the informal conversation. Hey, we already have the success. You need to get success within your gym first. We have a professional nutrition coaching program. We have the capacity to do this. It's amazing. We'd love to work with you. We know that 60% of the US population has at least one chronic disease. 40% of the US population has at least two or more. 50% of the population has diabetes or prediabetes, and 80% of the people do not know it. Did you catch that? 80% of the people do not know that who have diabetes or prediabetes, do not know that they have prediabetes. They have elevated blood sugar. They're walking around because they don't feel any different when it's slightly elevated, but chronically elevated blood sugar is going to cause problems. It causes your eyes to go bad. It causes numbness. It causes kidney damage. It causes your arteries to start getting clogged up and heart disease. When we look at the top 10 causes of leading causes of death in the United States, 9 out of the top 10 are caused or worsened by elevated blood sugar. Now, what can you do as a nutrition coach, as a gym owner? Talk about how to eat well. Talk about excess sugar and over consumption of processed carbohydrates. Talk about adding more whole foods in. Talk about having vegetables and fruit and having protein with every single meal. Talk about what are you drinking? Are you drinking water? Are you going to Starbucks and getting the Frappuccino with 60 plus grams of sugar, which is exponentially more than we need to eat in a day or drink in a day? People don't understand and they don't connect the crappy food that they're eating to the long-term side effects of this. That food's addicting, literally addicting. And can you have it once in a while? Do you have a treat? Yes, we go for ice cream once in a while. I have a cannoli once in a while. Absolutely. I love it. But that doesn't mean we need to have it consistently. And when people are eating well consistently, they start feeling better. They start having more energy. They're able to play with their kids after school. Their blood work starts changing in the opposite direction of what it has been. And they're able to prevent and reverse chronic disease. At Healthy Subs Nutrition, our mission is to help people take control of their health so they can prevent and reverse chronic disease. The fastest way to do this is to get connected with a group of people that need your help more than anyone else. And the people that a doctor is going to refer need your help. So, as I wrap up this podcast episode, I hope you are enlightened with some different ideas. You want to start by having that conversation. You want to train the staff. You want to get simple strategies for them to refer people to you, for them to get into your ecosystem. Maybe you offer a free virtual seminar for their patients so that people can get on your email list and get your nutrition emails consistently. If you're an HSN client, we give you the email content to send out in the healthy recipes so that you can get people getting to know you so that when they are ready, they're going to come to you. Once you have all of this set up, start having those conversations. And once you start doing it well and you get success stories, make sure you take those success stories back to the doctor. Hey, this patient has done an amazing job, or even better, have them tell the doctor how you've been able to help them and how simple the program was. And that's going to reinforce them to continue this relationship and continue to send people to you. Once you set it up, don't walk away. Once you set it up, keep going back and talking to them. Send them lunch. Send them a gift basket. Don't send them crappy food, please. They get enough crappy food during the holidays. Maybe you send an edible arrangements with some fruit or something so that you can just say, hey, thank you. I'm so thankful to be able to work alongside you and help your clients ultimately take control of their health. There's a huge opportunity for gyms and not many are taking advantage of it. There's some gyms in the HSN family that have done some really amazing things. I think of Julie Puzo, who's partnered with lots of different doctors in her area. Andrea from Amrock has partnered with doctors, but then also gone into their hospital, their local hospital, and started working with their patients in like an outpatient referral program. Like, how cool is that? I think for a lot of times when you go to the hospital, it's a big wake-up call. And that's where you might hit rock bottom and realize, I have to change something now. And if you can set up a partnership there, I think that's a really cool thing. But it didn't start there, right? She had doctor partnerships that she was able to slowly get connections and work her way there. So don't start with the big fish, start with the small fish. I think of Jeff from CrossFit Rome. He told me at the Gym Accelerator Summit, Nicole, we've been talking about healthcare partnerships. Did you know that Rome has the #1 capital, the most doctors in one area than any other area? I was like, no, but it sounds like an awesome opportunity for you to connect with lots of different doctors to become this health home in your community and really a safe place for doctors to send people to. There are so many people that are claiming nutrition experts and this and that, and you want to be the safe, trusted place that people can send their patients to. Again, this is a huge opportunity. If you don't have a professional nutrition coaching program right now in your gym, and you're like, man, Nicole, this sounds really cool, but I don't even know where to start with building a program. That's what HSN Mentoring is for. We provide gym owners and coaches with everything you need to build, launch, and grow a nutrition coaching program, from the business systems to the marketing support to the nutrition coach certification app to manage your clients. It's all there for you and packaged. We've been doing this since 2015, and I'd love the opportunity to help you too. If you're a gym owner interested in getting started, you can click the link in the show notes. You can book a discovery call with myself or Sarah. We will chat with you, learn a little bit more about where you're at. Is it a right fit for you? Is it a right fit for us? And if it is, we can invite you to get started through the training process. It takes about 30 hours to get up and running, and then you start working with your clients in-house, and then you start expanding to healthcare partnerships, employee wellness, and lots of other really cool opportunities. So hope this podcast gave you some different ideas. I will tell you that there's more cool things coming out in regards to healthcare partnerships that we will be talking about in the future. So stay tuned. If this episode was interesting to you, don't forget to subscribe and leave us a review. We'll see you back here soon.